This video will explain pelvic anatomy, what the pelvic floor muscle does and how it works. The pelvis is a ring of bone which contains and protects all our pelvic organs. Here is the pelvis in a side-on view. You can see the base of the spine to the left of the picture and the pubic bone to the right of the picture. Inside the pelvis sits the three pelvic organs: the bladder at the front, behind the pubic bone, the vagina and uterus in the middle, and the rectum at the back. The pelvic organs are all suspended in their position by a complex network of ligaments which you cannot see in this picture. They are also held up by a very important muscle called the pelvic floor. This runs along the bottom from the tailbone to the pubic bone. The pelvic floor is very important, so let's look at this in more detail. This picture is looking down into the pelvis. All the pelvic organs have been removed. Here you can see the pelvic floor muscle. There are several different segments and layers, but they all work together as one muscle. It's like a bowl holding all of those organs inside. You can see three holes piercing through the pelvic floor muscle. A small one at the front for the urethra, one in the middle for the vagina, and one at the back for the back passage. Because the urethra and the rectum have to pass through it, the pelvic floor muscle plays a very important role in controlling our bladder and bowel function. The pelvic floor has two actions. When the muscle contracts, it tightens and lifts, closing up the three openings, stopping the flow of urine and controlling your bowels. When the muscle relaxes, it softens and drops and allows you to urinate or open your bowels if necessary. Try doing a pelvic floor squeeze now. You might find it easier to sit or lie down. To do a pelvic floor squeeze, start by tightening around your back passage as if stopping yourself passing wind. At the same time, pull forwards and up as if to stop the flow of urine. This should create a squeezing and lifting sensation in your vagina. You may also be aware of a gentle tightness in your lower tummy. Then, to stop squeezing, completely relax your tummy, let go of the tension around your urethra and back passage and allow the muscle to fully relax. In order to check whether you're doing this pelvic floor muscle squeeze correctly, you may benefit from having a vaginal examination by a pelvic health physiotherapist. They can teach you a pelvic floor exercise program that is suited to your individual needs. Thank you for watching this information video about pelvic floor anatomy and the pelvic floor. If you have any difficulty following the advice in this video, or if you have any questions, please contact your pelvic health physiotherapist. Please also watch our Red Flags in Pelvic Health video to check any symptoms that need reporting to the GP.